Nancy. I'll be your student nurse for today. Let me just wash my hands. Can I please have your first full name, last name, and date of birth?
Danila Kowalczyk, 3/14/04.
Okay, perfect. And that's what I see here on your wristband. Danila, what pronouns do you use?
She, her, hers.
Okay, perfect. Thank you. I'll keep that in mind. Let me provide some privacy for us. All right, so today I'm just going to be doing a brief focus assessment on your urinary and sexual history. Is that okay with you?
Yes.
Okay. Some of these questions may be uncomfortable or triggering, so let me know if you have any questions, would like to skip a question, or if you'd like to take a break at all.
Okay.
Okay, sounds good. We'll go ahead and get started then. Do you have any illnesses attributed to urinary or sexual function?
No.
Okay. Have you ever been hospitalized?
No.
And have you ever had surgery?
No.
Okay. What medications, herbal remedies, or over-the-counter medicines do you take?
I take acetaminophen every once in a while.
Okay. Just an over-the-counter dose?
Yeah.
Like Tylenol?
Yes.
Okay. Have you had any medical treatment, surgery, or medications that have affected your sexual functioning at all?
Nope.
Okay. All right, so just moving on to family responsibilities. Do you have any children in the home?
I have two.
Okay, and they live with you?
Mm-hmm.
Okay. And are they both dependent on you?
Yes.
Okay. And are you responsible for the care of any other children, adults, or anyone else?
No.
Okay. All right. So we'll move on to the urinary system. I'm just going to ask you a few questions regarding that. All right, so I'm just going to be asking you questions about your voiding patterns. So that's just how often you urinate and things like that. Do you have a pretty regular schedule throughout the day?
What's regular?
Regular would be about 1,500 milliliters per day. So
Yeah.
you go multiple times a day.
Mm.
Okay. And do you have an ostomy?
No.
Okay. Do you have a catheter or a history of needing a catheter? Okay. And have you ever been told you have any history of kidney dysfunction or disease?
No.
Okay. Any family history of it?
No.
Okay. And do you experience any flank pain? So that will just be right here, where your kidneys are. Okay. And do you have any history of UTIs?
Nope.
Okay. Do you ever experience pain, burning, increased frequency, abnormal odors, or discharge?
Nope.
Okay. And are you on any medications that affect your voiding patterns, such as diuretics?
No.
All right. And then moving on to genitalia. So this will just be any concerns you have in the vaginal region. Have you noticed any redness, swelling, discharge, itching, or odor?
No.
Okay. Anything out of the ordinary?
Nope.
Okay. And have you noticed asymmetry, lumps, masses in the genital?
No.
Okay. And have you ever been told you have a hernia?
Nope.
Have you ever had any trauma to your genitals?
Mm-mm.
Okay. And then you said you have no problems urinating at all?
Yeah.
Okay. Moving on to menstrual cycle. So about what age did you start your menstrual cycle?
12
Okay.
years old.
All right. And when was your last period about?
20 days ago.
All right. And how often are your periods usually?
Once a month.
Okay. And how would you describe your flow?
Medium to heavy.
Okay. And how long do your periods usually last?
5 days.
All right. And do you have any problems with your periods, such as excessive cramping, breast pain, or heavy flow?
No.
Okay. Any other premenstrual symptoms?
No.
Okay. And does your menstrual period ever prevent you from going to work, school, or participating in activities that you enjoy?
Nope.
Okay. And if you don't mind me asking, what type of products do you use when you're on your period?
I use cotton pads.
Okay. Do you ever use a douche at all?
No.
Okay.
If your client were to say yes to this question, it is important to teach women that douching is unnecessary and is associated with significant risks. It can wash away the lactobacilli that clean the vagina and protect it from infection. Women who douche are at an increased risk for some STIs and for PID.
All right. And then moving on to cancer screening. Have you ever had a pap smear done?
No.
Okay. And do you mind me asking how old you are?
18.
18? Okay. Do you have a family history of ovarian cancer? Okay. So usually we recommend a pap smear when you turn 21, unless you have a family history that needs to be evaluated sooner. Okay. And have you ever received a vaccination for HPV?
Yes.
Okay. And do you ever examine your breasts?
No.
Okay. I know you said you don't examine them regularly, but have you ever noticed any asymmetry, lumps, masses in your breasts at all?
Mm-hmm.
Okay. And do you have a history of breast cancer in your family?
No.
Okay. And you said you're 18, so I'm assuming you've never had a mammogram?
Yeah, I've not.
Okay. And that one's usually recommended for ages 40 and up, unless you have a family history.
Okay.
Or symptoms.
Some questions centered around a male cancer screening include: have you ever been taught to examine your testicles? Do you practice testicular self-exam? Is there a history of testicular cancer in your family? Have you ever had a prostate exam or a PSA, prostate-specific antigen blood test? If so, what were the results?
All right. And then you mentioned you have 2 kids at home, so I'm just going to go into a little bit more about your childbearing history. So you have 2 living children at home. How many times have you been pregnant?
1.
Okay. Have you ever had a miscarriage?
No.
How about an abortion? Okay. And how many of your births were preterm, before 38 weeks?
None of them.
Okay. So just 1 pregnancy and 2 children?
Yeah.
Okay. And they were at full term?
Mm-hmm.
All right. All right, so the next section is just getting a little brief history on your sexual activity. Let me know if you get uncomfortable at all. We could skip some questions if you feel that way. All right. Are you sexually active?
Yes.
Okay. And how often do you typically have sexual intercourse per month?
Frequently.
Okay. Let's see. And how many partners do you currently have?
1.
Okay. And has it been that way for a long period of time?
Yes.
Okay. All right. Do you have any issues with your current sexual relationship at all? Okay. Have you ever experienced any changes in your sexual function, such as your level of desire, sexual activity, participation, or satisfaction? All right. All right, then we won't need to go into any more questions about that.
Okay.
When assessing the sexual activity of a male, questions will be more centered around male-presenting genitalia. Discussions could explore topics such as difficulty achieving erection or erection dysfunction disorders. It is also important to assess if the patient has intercourse with other men, as that could make them a higher risk for HIV.
All right, and are you on any type of birth control?
An oral contraceptive.
Okay. So how often do you take that one?
Daily.
All right. And how satisfied are you with that type of contraception?
I think it works for me.
Okay, perfect.
It is important to ask your client if they are taking any drugs that affect their sexual function. Here are a list of medications that may do so. Possible side effects range from enhanced desired function to decreased libido, delayed ejaculation, prolonged painful erections, and orgasmic dysfunction.
All right, and then regarding sexual history, once again, have you ever been treated for an STI?
No.
Okay. And are you concerned about STIs, STDs, or HIV?
Mm.
Okay. And have you ever been tested for sexually transmitted infections or diseases? Okay. And what precautions do you take to avoid STIs? You mentioned that you have one partner. Okay. All right. And then this last section, it might be a little bit triggering. I'm just going to ask you a few questions about abuse. Have you ever been forced to have sex against your will?
Mm-hmm.
Have you ever been threatened or abused by a partner?
No.
And do you ever feel threatened by your partner in any way?
Mm-hmm.
All right. Well, thank you for answering those with me.
Mm-hmm.
And I just got a brief history. So just one quick assessment piece that I'll need to do is I'm going to listen, just take a quick listen of 4 different quadrants, and then I'm going to palpate and feel for if you have any tenderness.
Okay.
All right, so I heard vowel sounds in all 4 quadrants. And then I'm just going to palpate. Do you feel any tenderness around your bladder at all?
No.
All right, perfect. Okay, well that is all the questions I have for you. Here is your call light. If you need anything, please let me know. Is there anything else I can do for you before I leave the room?
Nope.
Okay, perfect. And I'll just wash my hands. Look safe. The bed is lowered and everything, so I'm all good to go. Thank you.
Thank you.